In psychology, color blindness tests are used to assess a person's ability to perceive and differentiate between different colors accurately. These tests are commonly employed to diagnose color vision deficiencies, also known as color blindness. Color blindness is typically caused by the absence or malfunctioning of certain color-sensitive cells in the retina of the eye. The most well-known color blindness test in psychology is the Ishihara color plates test, which I mentioned in the previous response. It consists of a series of plates with patterns of colored dots, and hidden among these dots are numbers or figures that individuals with normal color vision can easily see, but those with color blindness may have difficulty identifying. Apart from the Ishihara color plates test, there are other types of color blindness tests used in psychology. 1. Farnsworth-Munsell 100-hue test. This test assesses a person's ability to arrange colored caps in the correct order of hues. It helps determine the type and severity of color vision deficiency and identifies the specific colors that individuals with color blindness have difficulty distinguishing. 2. Panel D15 test. This test is similar to the Farnsworth-Munsell 100-hue test but uses only 15 colored caps arranged in a specific order. It is quicker to administer and can provide a general assessment of color vision deficiencies. 3. Hardy-Randridler, HR, pseudoisochromatic plate test. This test is an adaptation of the Ishihara color plates test and is used to diagnose and classify color vision deficiencies. It includes plates with hidden numbers or shapes that are more challenging for individuals with color blindness to identify. 4. Cambridge Color Test, CCT. This computer-based test evaluates color vision and is useful for diagnosing and monitoring color vision deficiencies in individuals, especially children. 5. Cone Contrast Test. This test assesses the function of the different cone cells in the retina responsible for detecting red, green, and blue colors. It measures the sensitivity to specific colors and helps identify specific types of color blindness. Color blindness tests in psychology are valuable diagnostic tools, allowing psychologists, ophthalmologists, and other healthcare professionals to understand a person's color vision capabilities accurately. By identifying color vision deficiencies, appropriate interventions and accommodations can be provided to individuals with color blindness, especially in educational and occupational settings. Color blindness tests are used to assess a person's ability to perceive and distinguish different colors accurately. The most common form of color blindness is red-green color blindness, where individuals have difficulty differentiating between red and green colors. There are also other less common types of color blindness, such as blue-yellow color blindness and total color blindness, monochromacy. One of the widely used color blindness tests is the Ishihara color plates test. It consists of a series of plates, each containing a pattern of colored dots arranged in a specific way. Among these dots, there is a number or figure embedded, which can be easily seen by people with normal color vision but may be challenging or impossible to identify for those with color blindness. Here's how the Ishihara color plates test works. 1. The test is usually administered in a controlled environment, such as a doctor's office, clinic, or optometrist's office. 2. The person being tested is shown a series of Ishihara color plates, one at a time. 3. They are asked to identify the number or figure embedded within the colored dots on each plate. 4. People with normal color vision can easily identify the number or figure, which appears as a distinct shape among the dots. 5. However, individuals with color blindness may struggle to see the number or figure, or they might mistake it for a different number or figure. 6. The test results help determine the type and severity of color blindness in the person being tested. It's important to note that color blindness tests like the Ishihara color plates are only screening tools and not definitive diagnostic tests. If color blindness is suspected, Further evaluation by an eye care professional or an optometrist is necessary to confirm the diagnosis and determine the specific type and extent of color blindness. Color blindness can vary in severity, and people with this condition often learn to adapt and compensate for their color vision deficiency in their daily lives. Understanding a person's color vision capabilities is essential, especially in certain professions like aviation, transportation, and graphic design, where accurate color perception is critical for safety and performance. In addition to the color blindness tests mentioned earlier, there are a few more color vision assessment methods used in psychology and ophthalmology. 1. Anomaloscope. The anomaloscope is a specialized instrument used to diagnose and quantify color vision deficiencies, especially red-green color blindness. It consists of two halves, one with a variable mixture of red and green light and the other with a fixed yellow light. The person being tested needs to match the colors on both sides to determine the extent of their color vision deficiency. 2. Nagil anomaloscope. This is another type of anomaloscope used to assess color vision. It presents two colors that need to be matched by adjusting the intensity of a monochromatic light. The results provide valuable information about the specific type and severity of color vision deficiency. 3. City University Color Vision Test. CUCVT. The CUCVT is a computer-based test designed to assess color vision in a comprehensive manner. It evaluates various aspects of color vision, including red-green, blue-yellow, and total color deficiencies, providing a detailed profile of an individual's color vision capabilities. 4. Lantern tests. Lantern tests were historically used for assessing color vision in professions like maritime and aviation. These tests involved identifying different colors of signal lanterns used for navigation at sea. Although less common today, they were essential in ensuring safety in certain fields. 5. Cone contrast test plates. These plates are used to assess contrast sensitivity in individuals with color vision deficiencies. By comparing the contrast of different colors, the test can help identify specific cone cell deficiencies. It's important to note that color vision assessments are crucial for certain professions where accurate color perception is vital, such as pilots, electricians, graphic designers, and various other occupations that involve color-coded systems or safety considerations. Additionally, these tests are valuable in